After the more than record-breaking heat, we're seeing more records broken today, and the hot weather brings elevated heat stroke risk. A doctor joins us live with the signs we should be looking for next.
Spring is not even officially here, but we are dealing with record-breaking temperatures.
An extreme heat warning is in effect in many areas of LA County. So today we invited a doctor to talk about the most serious heat-related illness, heat stroke. We want to welcome Dr. Michael Coords, Medical Director of Cardiac Imaging at RadNet. Thanks so much for being here.
Thank you for having me.
So first off, we want to differentiate between heat stroke and heat exhaustion. What are the differences and what are some of the symptoms people should watch out for?
That's a really important question, and today very hot.
Yeah.
Just parking in the parking deck and walking over here to your lobby, I start sweating, and it's a whole spectrum of heat-related illness. So sweating is the very first step that I was having, and I was walking over here, and then it progresses to heat exhaustion and then heat stroke. So being that it's going to be very hot for the next couple of days, extremely important that people become aware of the symptoms and what happens. So your body generally does a very good job at regulating its own body temperature, but as the temperature outside starts to exceed your own body temperature, it gets more challenging to keep cool. So as that happens, sometimes your body temperature can actually increase. When that happens, you can get muscle cramping, nausea, dizziness, your heart rate can start going up. These are the warning signs. You need to be actively aware of this. This is saying, whatever you're doing right now, stop doing it, get cool. You need to stop it from getting worse. And that's heat exhaustion. On the spectrum, then progresses to heat stroke. Heat stroke is when it starts to affect your central nervous system. You can have trouble talking, walking, you could pass out, have seizures, even death. So very important that people are aware of the symptoms and take action before it gets worse.
If you have heat stroke, do you need to go to the hospital?
That is an emergency.
Okay,
absolutely.
That's an emergency. All right.
By that point, generally when your body temperature is greater than about 104 degrees, that is absolutely an emergency. You need to get to the ER if you have any of those symptoms.
Okay, and one of the things too, we keep telling people, hydrate, don't go outside during the hottest hours. Yeah, hydrate. But what about people that work outside? There are a lot of trades that are outside all day. What should they do?
When you're working outside and you have that requirement, it's challenging because you have to balance work with safety and the temperatures. If possible, you want to try to avoid direct sunlight the hottest time of the day. If there's something you're trying to do outside, try to do it in the early morning, in the evening. Take precautions to hydrate well. But the other part is not just related to work, but let's say you're outside electively. As I was driving here today, I happened to see someone walking their dog. They're outside, middle of the day, walking their dog. Your animals are susceptible to heat stroke, heat exhaustion as well, but also their paws. When you're going outside, even if it's later on in the day, you want to make sure you put your hand down to the pavement, not too hot. You want to make sure those paws are, getting cooked over there. Good
reminder. We want to start talking now about the heart. So the American Heart Association just released some new cholesterol guidelines.
Yes.
Walk us through those.
So what happened last week is there was an update to the cholesterol guidelines. We had Heart Month last month. We had a lot of different events happening there. And now we have new guidelines related to the management of cholesterol. It was about an 8-year update. The prior one is 2018. And in those guidelines, it talks about how to best manage people with high cholesterol or the risk factors associated with that. So there's a 134-page document. We hardly have time to talk about it all
What's
today.
the headline, doctor?
We have 3 main things I want to take away for the listeners today. One is lower for longer. You want to make sure that you identify people who have heart disease or are at risk for heart disease earlier in life and get their cholesterol levels in check. Lower for longer, the total cumulative exposure throughout their life, very important. The second part, which is really been a lot in the news recently, is related to something called lipoprotein A. So in your blood, you have multiple different cholesterol molecules and different types. People are used to getting their standard lipid profile. It'll say their total cholesterol, their LDL levels. Something that most people do not check for is lipoprotein A. This is a small molecule that's very atherogenic, so it's more likely to cause coronary artery disease. Most people have never been checked for it, and 1 in 5 people have it elevated. So it's very challenging to treat. So if you do have this elevated, you need to be very aggressive and offset your risk elsewhere. So now we have recommendations related to that. And third is related to the use of imaging in coronary artery disease. So now the new guidelines talk about getting a coronary artery calcium score for people who are at risk, men around the age of 40 and women around the age of 45. So 3 very important take-home points from that.
And are those the types of CT screening tests that they're looking for coronary artery disease? Okay.
Yes. So
okay.
for coronary artery disease, you really have two different types of screening tests. One is a coronary artery calcium score, and the other is a coronary CTA. And when it comes to screening exams, something that we do a very good job on is, say, screening women for breast cancer or smokers for lung cancer. We save countless lives that way. Great programs are set up. More women should get screened. But both of those groups of people are more likely to die from coronary artery disease. And mostly, we're not really checking for it. So it's really important that people talk to their doctor about it.
All right. Great tips and just a different way of thinking about some of these things. Doctor, thank you so much for your time. If you would like more information, you can log on to radnet.com.
And Kai, those tips on heat stroke and heat exhaustion, very important this week.
Absolutely. And we do need to heed those warnings and listen to that advice very closely.